All right, so there is a state of emergency where the national capital is concerned, where the third wave of COVID is concerned. Delhi is witnessing the maximum spike, viewers, across the world in sheer daily numbers reported. Total active cases right now in Delhi stand at 39,990. We've seen till now 7,614 deaths. We have also seen 4,37,801 recoveries. The average growth rate of the coronavirus in the national capital is at 1.5%. This data has been recorded just about 20 minutes ago by our producers right here of 6 p.m. However, that Delhi is now battling the COVID cases in the last 24 hours in terms of the spike is huge. 3,235 deaths in the last 24 hours have been 95. Recoveries in the last 24 hours have been 7,606. In the midst of this data, let's now show you how dire the situation is on the ground, because it's not looking good where the third wave is concerned. Now, this chart that I'm going to show you shows that Delhi's coronavirus crisis right now is much worse than any city that across the world reporting more cases than Delhi. National capital's current average daily dwarfs even cities like New York and Sao Paulo. You can see this, the red line that you can see right here is Delhi. So this is what we are looking at. So where across the world, Delhi is recording the maximum number of daily cases. The maximum strike across the world spike is in Delhi. Well, however, the health minister says that the worst is over. Well, this is an assurance given by the health minister. The health minister also went on to say that there is not going to be another lockdown, because there was, in the beginning, there were rumors because of the massive spike that Delhi has seen. Now, the Delhi government today asserted that there is no chance of another lockdown. The statement comes from Delhi Health Minister Satyendra Jain at a time when Delhi is witnessing a record surge in the number of COVID cases, recording the maximum spike even across the world. The Home Secretary called a meeting today to prepare an action plan in Delhi, implementing the guidelines issued by Home Minister Amit Shah yesterday.
लॉकडाउन करने के बाद जब लॉकडाउन किया गया था, वो दैट वाज ए लर्निंग एक्सरसाइज। उस लॉकडाउन से जो भी सीख मिली इतने महीनों के बाद, ये सीख मिली कि भाई जो लॉकडाउन से आपको बेनिफिट लेना है वो तो मास्क के भी ले सकते हैं आप। लॉकडाउन के बावजूद भी जिस टाइम लॉकडाउन किया गया, कुछ 100 केस पूरे देश में थे। जब लॉकडाउन खत्म हुआ तो हजारों में पहुंच गए। आज वो उतने केस जितने कि लॉकडाउन पूरे उससे ज्यादा तो एक दिन में आ जाते हैं। तो लॉकडाउन करने से इसको कंटेन किया जा सकता है, मुझे नहीं लगता संभव। सर्दियां स्टार्ट होती है, सर्दियों के स्टार्टिंग में ओल्ड एज की डेथ कुछ बढ़ जाती हैं, परंतु अगर आप एमसीडी से डाटा लेके चेक करेंगे तो ओवरऑल डेथ नहीं बढ़ रही। ऐसा होता है ना कि ओवरऑल इसकी वजह से डेथ बढ़ रही है। मंथली ले लीजिए, मंथ टू मंथ, पिछले साल का भी, इस साल का भी, उससे पिछले साल का भी ले लीजिएगा, तो मंथ टू मंथ डेथ्स नहीं बढ़ रही हैं। तो इसमें क्योंकि आदमी बीमार है, कोविड भी है, तो कोविड के खाते में जाता है।
Getting to my colleague Anisha Mathur, who's joining us live with the latest numbers from the national capital. Anisha, you've been speaking to the Delhi government officials. Two things are very clear. There is no question of another lockdown. And I would reckon, if at all, there is a silver lining in all of this in terms of the current spike in Delhi cases, is the health ministry of Delhi says the worst is over. Let's hope that's true.
Well, Preeti, the health minister seems to be indicating that the third wave that Delhi was reeling under, we saw the daily cases spike to over 8,000, almost till 9,000 per day. And in the last 2 days, the daily cases have been around 3,000, 3,200. Even in the last 24 hours, the number of cases, the new cases that have come up are in the around 3,200. So what the health minister is now saying is that the third wave that Delhi saw seems to be getting sorted. We are keeping it in control. But what is important right now is that everyone must wear masks. The social distancing must be done. The 6 feet distance that people have been asked to make to keep between each other must be done. Sanitizers, hand washing, all of that is very, very important. We saw the meeting that was held with the Home Minister yesterday. The Home Secretary has held a meeting today. The government is once again saying that there is not going to be any need for a lockdown at this stage, but the virus is not over. Remember, what he's saying is that the third wave is over. It is under control as long as people continue to wear masks and be careful. Back to you.
Anisha, appreciate you joining us. We're going to continue to come across to you. So those are the two big takeaways if one needs to look at it. Number one, there is going to be no lockdown in Delhi. So one can be rest assured of that. Number two, the Delhi Health Minister says that the worst might be over where the third wave is concerned, but that doesn't mean you let the guard down, because viewers, today, as of today, Delhi is recording the highest spike in positive cases across the world. Across the world. Let that sink in. Meanwhile, with taking on the story further, Delhi, which is witnessing a huge surge in COVID tally, as there is no let in case growth. Beds in the national capital are rapidly dwindling. India Today went on ground to do a reality check. Here's the full report.
It is Delhi's biggest battle. A massive spike in COVID cases and rapidly dwindling hospital beds. No city, not even in the United States, is seeing the growth in COVID cases that the national capital is seeing. Since November beginning, Delhi's COVID numbers are among the 10 worst globally. Delhi's current average daily new cases dwarf even cities like New York and Sao Paulo in Brazil. Seeing the dire situation on the ground, the centre says with the Delhi government. Paramilitary medical staff are being airlifted to the capital to counter shortage of doctors in Delhi. The Delhi government remains hopeful of containing the COVID crisis.
फर्स्ट वेव जून में आई थी, सेकेंड वेव सितंबर में आई थी और थर्ड वेव ये जो नवंबर में चल रही है, इसका पीक तो जा चुका है। आज मैं कह सकता हूं, डेफिनेटली आपसे कह सकता हूं कि डेफिनेटली वेव का जो पीक था, पीक इज गॉन। अब धीरे धीरे ये कम आएगी।
Of particular concern is availability of ventilators. Of the 1,342 ICU beds with ventilators, only 165 were available in the evening, according to the Delhi government's COVID beds dashboard. Private hospitals are the most in demand. Delhi's Sir Ganga Ram Hospital has no ICU beds available. Same is the situation at top private hospitals like Indraprastha Apollo and Max. Even the Lok Nayak Jayaprakash Narayan Hospital, the biggest COVID facility in Delhi, has 8 ventilators left, though beds are available.
During the meeting with the state and centre at MHA headed by the Union Home Minister Amit Shah, the centre has assured to provide ICU beds, 700 ICU beds fully equipped. Looking at the number which are in a surge in the capital for last few days, there will be more need of ICU beds. But at the moment, where the government says it has available of beds and wards around 7,900 in its own stock, private hospitals have wards, but there is lack of ICU.
The centre is now rushing to add 750 ICU beds to capital's existing capacity. Much of it will go to the 10,000 bed COVID centre built at Chhatarpur. With Ashutosh, Bureau Report, India Today.
I want to connect right now back to my colleague Anisha Mathur, who's tracking the COVID situation in the national capital. Anisha, on 2 points, what's the latest in terms of beds in hospitals, especially ICU beds? On the second account, is Delhi now going to look at once again opening out hotels to COVID patients that had been engineered earlier on in the first wave?
Well, as for your second question, that is something that the government is going to have to look at later. Right now, what we know after yesterday's meeting with the Home Minister is that the 715 more beds are going to be added. The 10,000 bed facility that was created at Chhatarpur, that is expected to be strengthened further. We've seen the fact that in most private hospitals, in government hospitals, there is a the number of beds that are available are rapidly getting low, as my colleagues have just reported, and we've just seen the report. The number of ICU beds are also very, very limited. So that is something that the government, the central government as well as the Delhi government are now looking at, that what kind of need is there, how many more beds are required. Remember, in the last 6 months, we've seen repeatedly, whenever we've seen a spike in cases, this entire question of hospital beds has come up. We saw the Delhi government and the centre trying to add more facilities. We even had, for a short time, we had had the idea that railway coaches are going to be converted into hospital facilities, isolation facilities. So a lot of things are being done, but at this moment, the number of beds is limited. We still do have some beds available in the private as well as government hospitals. Of course, the buffer is not as much as the government would like, given the sheer number of cases we're seeing every day. Back to you.
All right, appreciate you joining us, Anisha. Thank you there. Meanwhile, after the crucial emergency meet between Home Minister Amit Shah and Delhi Chief Minister Kejriwal last evening on the COVID crisis, the centre has announced a slew of measures to combat the pandemic in Delhi. Here's the full report.
It is Delhi's biggest battle. A massive spike in COVID cases. Rapidly dwindling hospital beds. And like in June, Home Minister Amit Shah has stepped in once again. Joining forces with the Delhi government, Shah assured of 750 new ICU beds at DRDO Centre. Testing will also be ramped up from 60,000 to 1 lakh a day. Amid string of decisions, Home Minister also confirmed that Central Armed Police Force doctors and paramilitary medical staff will also be airlifted to Delhi to counter shortage of doctors in Delhi.
केंद्र सरकार ने आज एश्योरेंस दिया है कि वो जो डीआरडीओ का सेंटर है वहाँ पे अगले 2 दिन में 500 आईसीयू बेड्स उपलब्ध करा दिए जाएंगे और उसके अगले कुछ दिन में 250 और, तो लगभग 750 आईसीयू बेड्स वहाँ पे अवेलेबल हो जाएंगे.
This is Amit Shah's second entry into Delhi's COVID fight. In June, Shah had stepped in to beef up Delhi's COVID fight and helped the capital flatten the curve. Delhi government, however, remains hopeful to contain the COVID situation.
जो भी उचित कदम उठाने की ज़रूरत है हम वो सभी उचित कदम उठा रहे हैं. मैं उम्मीद करता हूं कि हफ्ते 10 दिन के अंदर फिर से कोरोना की स्थिति काबू में आ जानी चाहिए, कोरोना कम होना चालू हो जाना चाहिए.
Experts in turn blame laxity from people for sudden surge in cases.
Where people are getting careless also. If you see they are gathering in community functions and they are not wearing masks properly, so long as our herd immunity doesn't go up to 60 to 80%, till that time we need to be very, very careful.
Delhi on Diwali saw over 7,000 fresh cases and over 90 deaths, taking its total cases to 4,85,405 cases and over 7,600 deaths. Bureau Report, India Today.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.